Greetings everyone. We are presenting a video titled Labyrinthine Convalescence Achieved Utilizing Best Indian Innovations. A 56-year-old male patient with right eye pseudophakia with hydrophobic monofocal IOL with BCVA 6/6. Left eye cataracta nigra with visual acuity counting fingers 1 meters. Luminescent and hard cataract, phaco is a challenge. Challenges include use of high phaco energy, difficult to create a full thickness crack, endothelial burn, stress on the granules, increased chances of wound burn and PCR, stressful for the operating surgeon and staff. We accepted the challenge and tried to modify our techniques accordingly. After proper staining of capsule, larger excess of 6 mm was done. After gentle hydro, phaco 1 was initiated with a central trench, settings of high power 80, low vacuum 150, flow rate of 80. Then phaco 2 was done with settings of power 60, vacuum 450 to 600, flow rate 36. Direct vertical chopping was done with phaco tip in bevel down position and by 1.75 mm sharp Mohanrajan chopper, and a full thickness crack was achieved, dividing the hard nucleus into two heminuclei. Now, as there is enough space going behind the nucleus, we now used blunt olive tip terminator Rajendra Prasad's chopper, which also acts as a dialer. Only with superficial impalement into the heminuclei and within the endocapsular margin and a high power and vacuum settings, dividing the heminuclei into multiple pieces which are then emulsified. In such a hard cataract, the cumulative dissipative energy was only 8.49 seconds. Thus, we have combined two types of chopping techniques to reduce the phaco energy and thus making it more endothelial friendly. Autofocus Pro IOL was then implanted. It can be called as a wonder IOL with no negative dysphotopsia, halos and glare, with good distance, intermediate and near vision, and is cost effective. It has two dialing holes and zigzag haptics. Zigzag outer edge of L-shaped haptic loops gives excellent rotational stability. It has also advantages of easy folding of optic and haptic with easy and smooth implantation. The two dialing holes has to be positioned in the upper half of the eye and helps in draining out any viscoelastic present in retro IOL space. Next day, distance vision was 6/18, clear cornea, contrast sensitivity 0.35, stereopsis greater than 800 seconds of arc, fundus and OCT are normal. Patient was very happy, but we are not. Then we started Orthoptech magnocellular stimulator therapy to correct his anisometric amblyopia. It has 3 rows of LEDs of central green light and others are red. Patient sits at 1 meter distance wearing the correction. Patient instructed to point at the light that switches on using a laser pointer. Procedure done first for amblyopic eye with good eye patch for 20 minutes and repeated with good eye open amblyopic eye patch for 5 minutes. Following this, patient is instructed to focus on the central green light and without changing gaze, count the peripheral lights that switch on about 200 times. This constitutes one session. Repeat the sessions for total duration of 1 hour daily for 1 week and then alternate day for 2 weeks. At post-op 3 weeks, distance vision was 6/6 parts, intermediate vision I6, near vision N6, contrast sensitivity 1.25, stereopsis 70 seconds of arc.
ఇవన్నీ మనకు వీడియో తీస్తాను సార్
దాని కింద చూడండి కళ్ళు మూసి తెరిచి చూపించండి ఇప్పుడు
పైకి కనబడుతుంది బాగా ఇది కొంచెం పైకి కనబడుతుంది, ఇది కొంచెం దీనికంటే కొద్దిగా పర్ఫెక్ట్,
అదంతా ఏమవుతుంది, జస్ట్ ఏది కనిపిస్తుందో అది చెప్పండి.
ఇది కొంచెం పైకి, ఇది సేమ్ కానీ ఇది మధ్యలో కొంచెం వేసినట్టు కనబడుతుంది, కింద గిరి కొంచెం పైకి కనబడుతుంది,
ఇందులో
మధ్యలో కొంచెం
దీంట్లో
గిరి,
ఇందులో
గిరి,
దాంట్లో
ఏమనిపిస్తుంది
అంతే కదా.
దీనిలో కొంచెం
సరే.
To achieve binocular single vision with distance vision 6x6 parts, intermediate vision I6, near vision N6, it seems magic, but this is pure science. So in this case, we used innovations like Mohan Rajan chopper, terminator chopper, combined phaco chopping techniques to keep dissipative cumulative energy at lowest level with least endothelial damage. By implanting our Autofocus Pro IOL, we fully corrected refractive status of patient, and finally the most novel treatment, Orthoptech magnocellular stimulator therapy was given and target emetropia and binocular single vision achieved.